Hey there, future nurses, and welcome. Today, we're going to break down a skill you've been doing, well, a lot. I'm talking about the finger stick. It might seem like a really basic task, but trust me, getting this right is absolutely crucial for your patients.
So, you ready to really nail this core nursing skill? Awesome. Let's dive in. Okay, so what are we really talking about here? Basically, capillary glucose testing is just a tiny skin puncture to get a quick read on a patient's blood sugar. But don't let its simplicity fool you. That one little number, it tells us a massive story about what's going on metabolically and helps us decide what to do next. All right, let's kick things off with phase one, preparation. Everything you do before you even walk into that patient's room is so important. Seriously, nail this part, and the rest of the procedure will go so much smoother. Your first stop, always the client's chart. Think of it as doing your homework. You're on the lookout for key info. Things like latex allergies, maybe a medical condition that could throw off the results, or if they're on a blood thinner. Knowing all this, plus seeing their past glucose readings, helps you walk in prepared for what to expect. Okay, next up, let's gear up. You want to gather all your supplies before you go into the room. This is what makes you look like a pro, right? It keeps things running smoothly, and honestly, nobody wants to be that person running back and forth for supplies while the patient is just sitting there waiting. All right, prep work is done. Now we're heading into the client's room. This is phase two, and it's all about your patient and safety. This is where you connect, build that trust, and make absolutely sure you've got the right person for the right procedure. Okay, these 6 steps, they're your absolute must-dos. You're going to provide some privacy, introduce yourself. That's how you start building that all-important relationship, and wash your hands. Then comes the big one. Check 2 patient identifiers. You got to be sure. Confirm their allergies one more time, and then just explain what you're doing. It sounds simple, but it makes a world of difference for their anxiety. And now for the main event, phase 3, the core skill. This is it. The actual finger stick. Let's break down exactly how it's done. First things first, get your clean gloves on. Now, pick your spot. The side of the finger is usually perfect. Give it a good clean with an antiseptic wipe. And here's a pro tip. Listen up. Let it air dry completely. Don't blow on it, don't wave it around, just let it dry. If you poke it while it's still wet, it can sting, and even worse, it can totally mess up your reading by diluting the blood. Once it's bone dry, you're ready to uncap that lancet. Okay, place the lancet firmly against the site you want good contact, and then activate it. Now, just a little gentle squeeze to get a nice bead of blood. Don't go crazy. Touch that drop to the test strip until it's covered, and right away, get some pressure on the site with your gauze. Now, this right here is probably the #1 mistake I see people make. Milking the finger. If you squeeze way too hard, you're actually bursting the red blood cells. It's called hemolysis. And guess what? That gives you a completely garbage reading. The whole test is a waste. So remember the mantra, gentle pressure. So the meter is doing its thing, but hold on, you're not done yet. We're moving into phase 4, follow-up and documentation. This is how you professionally close the loop. This is where your nursing brain really kicks in. You have to ask yourself, does this number make sense with the patient I'm looking at? If they're clammy and shaky, you're expecting a low number. So if the meter pops up with a high reading, whoa, red flag. That's an unexpected outcome. First thing you do, recheck it. Always verify. And then, of course, documentation. You've heard it a million times, and it's true. If it wasn't charted, it wasn't done. So you're going to log the date and time, where you did the test, the actual number you got, and, super important, what you did about it. This keeps the whole team in the loop. Okay, before you even think about leaving that room, do a quick final safety sweep. Call light handy? Check. Bed down low and locked? Check. These little things are huge for preventing falls and just making sure your patient is safe and sound. All right, you've got the basics down. Now let's level up and talk about some key things to keep in mind for specific patients. Knowing this stuff is really what's going to make you stand out.
2 things you absolutely have to know. 1, if your patient has bad circulation in their hands, a fingerstick could give you a bad reading. A great backup spot? The earlobe. 2, for babies, it's a hard no on the fingers. You always use the outer part of the heel. This prevents some really serious injuries. These are huge for your exams and even bigger for your practice. So here's the big takeaway from all of this. It's one thing to memorize the steps, but it's another thing entirely to understand why you're doing them. The rationale is everything. That's what's going to turn you from someone just going through the motions into a truly safe, confident, and amazing nurse. So I'll leave you with this to chew on. We've talked a lot about the how, but step back and think about the what. Isn't it kind of amazing that one tiny drop of blood can tell you so much, so fast, about what's happening in someone's entire body? It really is a powerful tool you've got there.
Hey, if this explainer was helpful for you, do me a huge favor and hit that like button, share it with a friend, and subscribe. It really helps us keep making more of these videos for you guys. And hey, when it's time to get serious about studying for your exams, make sure you check out the links in the description below. We've got some awesome summarized NCLEX revision books that are perfect for all your nursing courses.